All right. In the ever so 4:03 or whatever, 3 minutes past the hour time, it is my incredible honor to have us all gather here today. It's the culmination of our digital literacy and digital access work over the course of the spring and summer. For reference, it was a little bit off cadence this year because we started a little bit late, which is why we usually finish a domain in June. But we're very excited that we finished and give you all a little bit of a break coming up maybe the last couple of weeks of August. Next slide, please. Standard practice. We welcome everybody for joining. Many of you are old friends. For anyone who's new, we meet you upon entry. We ask you remain muted. We do unmute and have conversations. All calls are recorded. Recordings are always available on the Gravity Confluence page following for reference. And you're encouraged to actively participate in the discussion using the Zoom chat and just type them to everybody. And I'll do my best, as usual, to try to make sure they're centered in the conversation. Next slide. This is the common antitrust practices slide. We just have the responsibility to comply fully with federal and state antitrust laws. Next slide, please. These are our sponsors. We are incredibly grateful to our sponsors. I'm going to say this one more time because we're about to go a little quiet for about a month. As many of you all remember, we were not able to we had to go on work pause last year at this time due to the support of our sponsors. We are going to be reconvening very shortly to continue the work that we do together. And we're incredibly grateful for all of them, every in-kind sponsor, every monetary sponsor. This work is a collective, and the collective is identified in the membership. Anyway, thank you so much to all the 2023 sponsors. If you want to become a 2024 sponsor, you can reach out on the Confluence or to gravityproject.hl7.org and connect with our program manager, Vanessa Candelora, for looking into 2024. We have some pretty exciting things going on, and we're very grateful for everybody's help. Next slide. So this is the agenda. I'm going to go through some updates to project schedule and overview. So you'll see some things come back that we wanted to make sure we could complete in 2023. Himali has some pretty exciting updates regarding terminology build. We're going to go just roughly through some very high-level updates that happened as we integrated end-to-end review comments into the digital literacy and digital access decks. And then one final review of those all domain updates and revisions, and then go into vote. And the conversation on the vote is going to be led by the amazing Sarah Bahal, who is, we were just extolling the virtues of on our internal meeting a few minutes ago. She's a critical force of within our work, and you probably know if you've ever sent an email to gravityproject@hl7.org, you know that. So thank you so much, Sarah. She's going to walk us through the consensus voting process, and then we're going to close. Next slide, please. Next slide. So we're super excited to state that the STU 2.1 has been published. You can find the new IG on the HL7, on the Confluence, and of course in HL7. Again, just a note that that effort was hugely influenced by the support of MITRE through CMS, and so thank you to our MITRE friends. We had a great July Connectathon where we tested that proof of concept for the social needs supplemental benefits. More of that is definitely available via the CMS Connectathon, Whovas, or on the Confluence as well. We have both the September Connectathon coming up, and then looking forward to the January Connectathon. We are looking at a presence at the working group meeting, not necessarily the Connectathon in Phoenix, but at the working group meeting, and look to find us there, and then looking forward to the Connectathon in January. Super excited to also say that the talked of social care co-design sessions have officially begun. They kicked off on August 10th last week. Very great thanks to everybody who's participating. There's a special page on the Confluence to learn more about the bios of the really amazing people who are coming together to help with this work and the project team over there. And then we'll post the agendas and key takeaways sequentially as they come through as well. So there's a special page on the Confluence now for that social care co-design voice session, and look forward to key takeaways, a high level, and then our final summary report coming in the fall. Next slide. And next slide. This is some exciting stuff. Super excited to say we are going to do a few quick domains. It's a short session, of course, because usually we start new domains a little bit like now, because we had just had our summer off for build. But because, again, we delayed the start of digital access and digital literacy in order to focus on build, you'll see more about that in a second. We have to take a quick break now because we have submissions to work on, submissions to IC10CM, submissions to SNOMED CT. And so we just kind of have to go quiet for a little bit as we do full tilt boogie deep into submission land. We really wanted to make most of the last month of 2023. And so we hope to come back and plan to come back September 28th. So not as long a break as we usually take. September 28th, we'll be coming back and working on 2 initiatives that we have on the, we're saying it's proposed, but we're pretty likely. So just come back in September and we'll be good to go. And this is what we've talked about before, the Coding for Food initiative. This is a partnership with our friends in the National Food Bank System, Medically Tailored Meal System, we have the American Academy of Nutrition and Dietetics coming back. And this is an initiative to create HCPC codes for specific food services. These have been long in the works. This is part of our food insecurity work that we kicked off in 2019. That's now come to fruition with this special initiative for HCPC codes for food. Again, very, very excited for that work. And then also recognizing the need to really support our implementers and our members in readying for reporting with the IQR social screening for social drivers of health measure. We're thinking and planning on leveraging this moment in time specifically to lean into utility and security value sets, which will be kind of, early value sets. And then in 2024, we're going to be kicking off a whole set of new domains in February in our normal time. And utility and security will be one of those domains that we have on the roadmap. So part of becoming a member is supporting that work. So if you want to come and help us develop materials to support, drivers such as CMS quality measures, we would love your support. And we really are trying to support implementer friends with quick release of value sets to support that work in 2023, and then a more robust full build for utility and security in 2024. I'm going to pause for a second and make sure that nobody has any questions. The Coding for Food work, we've talked about that in the past. It's just back. Super excited to work with my food insecurity friends again. And then the utility and security value set build is a very small little section. And then we'll also, of course, be working on our IC10CM submission together to ready for the December submission. And that will be collective work as well.
Sarah, did you say there would be other domains to be addressed in 2024?
Yes, ma'am.
Did you list them and I missed it because I was multitasking?
No, right now, so this is, I didn't, all I said was utility and security is on the roadmap for 2024 specifically. Along with, we are hoping to do further deep dive into transportation and security. And we actually have room, we're working with our operating committee, our member leaders there, to define other domains that might be necessary, that we have a massive sandbox, right? So we have a very large sandbox of things that we wanted to work on. So again, funding dependent, we hope to stack a few other things into the 2024 spring build.
Thank you.
Yes. Any other questions? All right. I just want to thank, there's a couple operating committee members here on the call. Our operating committee is kind of the strategic wing of the membership. And we're really, really grateful for their guidance as we try to pick priorities amidst the many, many things people have asked us to do for a very long time. Besides the 2.1 updating tech, it's nothing else there. And then everything else in pilots keeps on humming along. We're heading into the Civitas conference next week and look forward to reconvening pilots affinity call in September. Next slide. Again, this is what I just said. So follow consensus voting today. We're entering a 6-week build only period. Again, this is a very standard process for anyone who's been part of the group. We just kind of need to deep dive eyes on the prize, get all those submissions in. Our next meeting will be September 28th. We're going to focus on small projects that we are all stacking into a shorter period than usual, coding for food, utility and security value sets, and then an IC10CM submission. Any questions? All right. Okay, next slide. All right, next slide. Now I'm passing the mic to my dear, wise friend, Hamali Setwal. Just for everyone's reference, the core gravity terminology team, I have the honor of being the fearless leader. It's not so fearless all the time, but I work with amazing people, Hamali Setwal, Sarah Bahal, Monique Van Berkom, and Asha Manuel. Those people are my daily friends and colleagues in this work. And so it's my honor to pass it off to Hamali. Hamali, you ready?
Yes, Sarah, thank you. So last month, we shared this slide and all the value set. This provides an overview of the value sets that we needed to update based on the new codes released in Sinomed City and ICT. So Sinomed City update for all the listed value sets happened last month, and we were still awaiting for ICD-10-CM 2023 April codes to be available in VSAC. So this month, those codes are available, and we were able to successfully perform the update for those value sets in VSAC. Now, all these highlighted value sets for ICD-10 codes are updated in VSAC and available for public use, except for the one highlighted. That code is present. So there is one code in health insurance coverage status that is shared in March meeting, and that will be available for use in October. So once that code is available, we will update that value set. But other than that, all the value sets are up to date in VSAC. So next slide, Sarah. So this is just an overview of all the ICD-10 Z codes and T codes that we updated in value set, respective value set. Just for your awareness, we have put together next 4 slides so you can take a look at which codes we have updated for respective value sets in VSAC. So Sarah, so material hardship, elder abuse. So yeah, material hardship, elder abuse, health literacy. Next slide. Social connection, intimate partner violence. Next slide. And inadequate housing. So a lot of work that has been done in 2022. And we worked with Sue Bowman and other AHIMA friends. Sarah worked very closely with many of those, and through their assistance, we were able to submit these codes, and they are now available for public use. So, Sarah, next slide. So, one thing, Sarah, you have to say something.
No, you're good. I was just proud of you. You go.
So, I just wanted to share for your awareness that the social determinants of health group or value sets are now included into CCDA value sets to maintain the alignment of CCDA value sets with USCDA and USCORE. So this was another small project I was working on, and I was very excited to see gravity value sets included in that project as well, so that we can see gravity represented across USCORE, CCDA, USCDI to maintain the synergy across the ecosystem. So this is another small update we thought we should share with you. And with that, I will pass the mic to Sarah. Thank you.
Thank you so much, Hamali. This is actually pretty exciting. I forwarded the CCDA. I got the ping from NLM and I forwarded it to the team. So, and we all had a little hooray. Again, thank you to all the work. So we do the building here. I mean, we do the identification here with this team, but what happens is like the workshop afterwards, right? So all of the terms submitted and all the value sets curated, and that's kind of the final product of everything that we do. Very grateful to start seeing the fruits of our labor. and referenced by other standards. So it's very exciting. Next slide. All right, we are here at the vote. I just want to take a moment. Of course, I'm a big moment person, to recognize all the labor that's come into this moment in time. Extensive, really committed engagement by all of you all. We're really grateful. So many wonderful comments. You all took the end-to-end review very, very seriously. We had a couple comments, just want to note, a couple comments that didn't get submitted in time in order to perform the level of diligence that we always perform by bringing things to subject matter experts, reviewing it, ensuring there's definitions for you all to review. So just like Teresa's comment in the chat, anytime things that aren't necessarily ready for the consensus vote per process, we'll always just bring them back, right? So when we reconvene in September, we hope to have a couple different concepts that were submitted late, past the end-to-end review submission date, brought back to the community for review. It just, we need to make sure we don't delay the vote. We need to make sure that all of you have time to review something that has definitions and a clear sense of, of clarity of purpose in the actual term. And sometimes these things are a little hard for us to work through because they're new. Everything we make is new. So we'll bring them back in September, but we're now really excited to go through the vote. We're just going to highlight key new updates. And even though I always say this and I'm never correct, maybe we'll end a little bit early, but who knows? Next slide, please. Here we are again, the culmination of work since May, the digital access and digital literacy consensus vote. And again, Sarah Bahal is going to be going through the details of the vote at the end of the call, right? We're going to roughly cover how the process and updates, and then Sarah Bahal will walk you through how to vote at the end of the call. Next slide. Next slide. Again, an honor to work with these 5 brilliant folk: Walter Suarez, Adriana Nava, Adriana Aguilera, Bhumika Majola, and Jorge Rodriguez. They are now our friends. And we have the honor of making sure that we can call upon them for future wisdom, but we wouldn't have been able to do this work without them, and we're incredibly grateful. Next slide. All right, the way voting works. And I know those amazing 5 weekly meetings for months is a big commitment. And they were definitely just an amazing part of that work. So grateful. I want to review very carefully the general principles of voting. And then again, Sarah Bahal is going to go through them again at the end. And this is really important because basically anything but a yes purely involves some kind of engagement and commitment to giving us more information, because we've all collectively worked on this over the past months. So if something needs to be changed at this 11th hour, we really need to make sure that we understand why. So yes, a yes vote, this is what they all mean. A yes vote does not necessarily mean that the deliverable is the ideal one from the perspective of the committed party, but it's better to move forward than to block the deliverable. Yes with comment is when a consensus process attracts significant comments through yes with comments. It's expected that the comments will be addressed in a future revision of the deliverable. So when we come back in September or otherwise. Formal objections, this vote has to, because we are all responsible to each other as a community, include comments indicating a path to address the objection in a way that meets the known concerns of other participants in the project, right? Part of forming this community and committing to end-to-end review and committing to the consensus process every other week is that by now we're accountable to each other, right? So if it's a formal objection, we want you to make sure that this is just standard HL7 processes. We want to make sure that you keep the concerns and voices that the others have had on the call for the last few months in mind. If you do not offer such comments, it flips to an abstention. I'm sorry, this is also formal, but it's because what we're doing is actually really important. It gets bound into policy and part of this process, and is why the federal government trusts us to do this type of thing, because we're fairly formal when it comes to this. And then the last is abstention. It's just when you decline. So those 4 comments, and again, Sarah's going to review them again later, is yes, a simple yes. Yes with comment, which means we bring it back later if there's enough yes with comments. Formal objections means you have to give us a path forward, taking in the collective, and then abstain is abstain. All comments are due by the 24th of August. Any questions? Oh, everyone's eligible to vote. We're very careful here to honor the fact that not all community participants are able to be Gravity Project sponsor members or even able to sit on our membership committees. So you all matter, you all vote. Please, everybody vote, right? And so as a collective, we're all equal in this moment. Does that make sense? Okay. Looks like it does. Okay, next slide. All right, we're going to quickly go through these slides because we really are going to highlight things that have changed through the end-to-end interview process. And again, this is fairly boring, procedural, but this is the end of our work. Next slide. No change. When there's no change, I'm just going to say next slide. Next slide. Here's something new, right? So in reflection, you can see there's a change between the prior definition for inadequate digital access affecting healthcare, because we were talking about the limitation of appointments versus the concept of encounters. And so we flipped appointments because it's limited to encounters to be more inclusive. Again, all of you saw, we posted the masters early on Tuesday and you all have had this, so hopefully this is no surprise. Again, this came out of working together with our subject matter experts and end-to-end review comments. Next slide. Next slide. Next slide. And next slide. One thing I want to note, very grateful for some people commented on the content of the actual masters, and some people really helped us with framing the way we frame things, right? So one of the comments was regarding the way we frame the types of things in our interventions lists, because professions is a limited way to describe what people do, and roles is more inclusive. And so in review collectively, we realized that that was probably wise. And so we'll be shifting going forward to programs, professions, and roles. Going forward. And again, this is not in the content of the master, it's in the way we organize ourselves and talk about what we do, but it seemed pretty straightforward and important to consider. Next slide, please. And then here's where you can see that, because you can see that when it comes to type, that's where that roles comes into play. Next slide. Next slide. And then here, we want to know, again, very grateful for, some really expert end-to-end reviewers who helped us expand the profession of reference from simply lawyer to attorney, and helped us advocate for a new profession for a non-attorney legal advocate. Thank you so much. I know that it's actually the non-attorney legal advocate that I work directly with in my FQHC. So the fact that it wasn't there is remarkable, and very, very grateful for adding this critical role, especially on the clinical and social care integration perspective. So this is we expanded to add attorney to at the synonym to lawyer, and adding non-attorney legal advocate as a critical professional role.
Sarah, could you clarify the difference between attorney and lawyer?
Is Samantha on the call? There is. There she is. Yes.
I am, and I'm happy to. Hi. Hello. Yes, the difference actually is that while all attorneys are lawyers, in that lawyers have graduated from law school, not all lawyers are attorneys, because you actually, to call yourself an attorney legitimately, you actually have to be admitted to the bar of a particular state. You have to have passed the bar exam, and it means you're actually licensed to practice law. You can be a lawyer and yet not actually have a license to practice law. And therefore, if you are claiming to represent someone, you might be engaged in an unethical practice. So we don't mean to get too much into the weeds here in terms of, sort of professional responsibility language, but to just use the word lawyer felt like it would be a small and important thing to expand that to include attorney.
Lucy, did that answer your question?
Yes, I just put it in the chat. Thank you.
Wonderful. Hi, Mike.
Hi. So I have a question based on what Samantha just said. So it's possible that a lawyer could be a non-attorney legal advocate. And so does that make the distinction between those two classes not clear?
The definition should make it clear, ideally. But Samantha, what do you think there?
So you could have finished law school, but be a non-attorney legal advocate. So you might technically qualify as a lawyer.
It's true. And I think I really, really appreciate your point, Michael. And I think it's something for us to consider. I think that, yeah, you've given me a lot to think about right now. Unfortunately, I think too often the word lawyer also can refer to someone who is a licensed attorney, and that's where we might hit the challenge in terms of sort of plain usage and wanting the language to be as accessible as possible. But I don't have a great suggestion right now. I'm sorry.
We are working with Samantha. We have some meetings planned because when you look at her resume, you know why she's such an expert in these things. To help clarify this, it looks like Hamali has a comment, but the definition will help us. But also, if you feel this is a great opportunity for, say, like maybe we need to keep on working on this, that's also possible. That's what the yes with comment is for. Hamali?
Yeah, so when I think about this category of non-attorney legal advocate or non-attorney advocate, lawyer can be one of them, but there can be others who are not lawyer who can also be non-attorney advocate. So it can be I think more broader umbrella, but we
Yes.
can, yeah.
Yeah, like Amy just wrote the same thing. And I think our definitions can really help us here. But Mike raises an important point, and I feel like we can clarify it going forward. And certainly in my experience, the people I work with directly in clinic are not lawyers and not attorneys. They are lay folk who are trained in legal capacity enough to work directly with clients and elevate it and triage it up as needed. What we can do is we can drop the working references for non-attorney legal advocate into the chat. But again, also, if this one is sticky, it was on the master, but if it's a sticky point, we can keep on mulling it over as when we reconvene in September, and that's absolutely fine. And that exactly so says Mike. All right, any other questions? I love the fact that you all are so thoughtful about this. I do recognize it as a critical gap, that role, not profession. Thank you, Samantha. But we can either refine it with a definition or we can clarify it otherwise. But Tom's saying, what about attorney and the other non-attorney? We have a few. Yeah, and then Tom, I think this kind of the logic actually is very similar to what we have up here, right?
Mhm.
Yeah.
Yeah.
Any other questions? Critical gap, semantics and definitions.
Yeah, it's odd that the similarities to doctor and physician, you graduate from medical school, you take an exam, you get a license, you're a doctor.
Mhm.
Physicians, so what's the difference? So then you get into these excruciating details about exams that you've taken or additional training, or there's interesting parallels here.
Sarah, this is Samantha again. I
Okay.
just wanted to say, I think it's Michael and Tom who at this point have suggested attorney as opposed to non-attorney legal advocate. And I just want to, which I think could be a nice solution if we're not worried about losing the word lawyer, even though, I think it got in there initially because it's a kind of plain usage word, even though it has a technical distinction that we've discussed. I just want to acknowledge Amy's comment, who would be maybe it's not Amy's comment. Sorry, Amy Sheehan. Can a non-lawyer be a legal advocate? Not to bring us into the weeds, Amy S., but only if they're providing legal information as opposed to legal services. And so there are, sort of scope of practice issues here that we also get into at the definition level. But I guess I just want to clarify, Sarah DeSilvi and others from the Gravity team, as someone who I'm outing myself as the person who submitted this comment to the team. In the course of that iterative exchange with the subject matter experts, I do think that the parlance is actually trending more toward non-attorney advocate as opposed to non-attorney legal advocate. So I just want to own that my initial suggestion was this three-word term, but I modified that to just non-attorney advocate based on some of the literature. I don't know if that helps to inform any of the comments and insights that people are sharing on this call. And I want to respect the process that I know Gravity goes through in terms of all of the written comments and how they evolve. But in any event, I see Michael is weighing in the chat, and I just wanted to clarify those few points.
And I do feel like the definitions will help do this. And this is a unique situation where I think we know exactly what we're talking about, right? It's not that there's not lack of clarity about the thing. We just need to figure out the best way to say it and the best way to define it as distinct from the other things, right? So it's like but I think that we generally agree that this is a missing role, and we're glad that it was submitted. It was. I will use the anonymous. And we'll work toward refining those things over time. And we can always, if we feel like it, if there's any concerns, we can always bring it back in September. But I think we're probably in a good spot to go forward now. Any other questions before we go forward?
This is Tom. I was just going to make a real quick comment. What about making the second one non-attorney / lawyer legal advocate, and then in the definition simply say attorney lawyer is somebody who has completed school. Non-attorney legal advocate is somebody providing legal advice, but who has not completed law school.
That would end the ability for a non-attorney legal advocate to be a lawyer.
Right.
I got you there. I see what you did there. Thanks, Tom. Does that make sense what he just did?
Yeah. Do you need me to write that and put it in the comments?
No, I think this is a different time, right? So again, you could write it and put it in the comments, but I think also, to be honest, we already had planned to meet with medical legal partnership experts after the call, to gather like a little huddle to make sure we got these right. And so that's still on the agenda, and I think we can bring that to that group. Understanding that we generally agree on the thing we're trying to say. It's not one of those where we're navigating boundaries. The boundaries are agreed upon, right? We just need to get a nice term and a nice definition. Does that make sense?
I would just put in my 2 cents to Jonathan that power of attorney has nothing to do with legal advocate. Anybody can have power of attorney. So
That is, yeah.
I don't think that works. Thank you for even thinking of it.
We do include power of attorney terms in our elder. We did that with our elder build or elder abuse build, because power of attorney and guardianship was such a critical role of that domain.
Definitely.
Yeah.
But they're not legal. I was about to say they have no legal standing, but actually they do. So I'm going to stop. Okay.
I know all of us wish we had our own lawyers right now as we're talking about this. Yeah. Any other questions here? Are we comfortable with the state? This is a kind of a unique situation where, again, we know exactly the rule. We're just refining the way we say it. I hear what Tom said actually is kind of nice because then it ends the ambiguity between the two. And then we have promised to convene some MLP experts to help us make sure that we get everything tidy. I want to note, just as a constraint, sometimes we have a hard time submitting, haha, Tom. Sometimes, not a hard time, but sometimes there's constraints in submissions that we want you all to be aware of as well. There is a taxonomy of professions called the National Uniform Claim Commission. If there's not a definition for that role in the NUCC taxonomy, sometimes it's hard to advocate for it to be in terminologies, right? So if the National Uniform Claim Commission has not decided it is a thing, like a role with a clear definition, that sometimes is referenced by the terminologies and taxonomies we work with as whether a role is ready for prime time. So even us agreeing on this also has contingencies and dependencies. And so in the past, what we've done is try to advocate for submissions to NUCC to enable us to submit to other terminologies. Does that make sense? It's complex, but it's like steps. I can put a link to the NUCC in the chat so everyone's aware. But as we do this work, I just want everyone to know there are constraints that we move within its terminologies and taxonomies and how they interact. Oh, thank you, Teresa. Great. And if you search for non-attorney legal advocate, you'll note it's not there. Interestingly enough, it's new terms that need to be referenced with the NUCC. There's a lot that's not there that's already in our work as a profession or a role. It's when we're going forward, sometimes we need to reference the NUCC. So thank you, Teresa. All right, next
Sarah,
slide.
this is really reaching, but when you file your income tax, if you're a professional, they have numbers for all different types of professions. Is that a resource?
Maybe, we'll see.
And it may be hopelessly out of date. Maybe they did that in the 1930s. But I have a number, and I'm sure that a lot of people on this call who do offline or independent work have a number when you do your income tax.
All right, it might be helpful to make the case. Thank you so much, Lucy. All right, now you know why we go quiet during build for a little bit, because we have all these little things we have to work out. I want to note our friends at SNOMED CT. I just saw Kathy Richardson on the call. I have the joy of reconvening with Kathy shortly to help with all these submissions. So our friends at SNOMED CT International and US are great colleagues in this work, and we're very grateful for them. Okay, next slide. All right, there's nothing in instruments that's new, so we can just scroll through them, but for the sake of courtesy, we're just going to quickly click. Next slide. Here we go. Next slide. Okay, and now to definitions. There's just a lot of repetition of what we saw earlier. Nothing exciting, new, just some of the same themes. So next slide. Again, we have encounters replacing appointments. Next slide. And then we have really wise submission. Like sometimes we just miss things. Like we missed this, right? We always try to have a parity between a problem statement and a goal. And when we built our goal terms, we had a goal for the basic digital literacy, but not a goal for just digital literacy in general, even though we had problem statements for digital literacy in general. So we created an inverse of the base problem statement of inadequate digital literacy, and then that became a term. So thank you for taking you to the commenter who noted that this was missing. It is now there. And when it comes to definitions, I'm in like grateful mode. I just want to thank Monique Van Berkom, who's an amazing member of our team in kind from the AMA, who helps really think through some of these definition stuff, because that's one of her areas of brilliance, one of her many. So this is just a, so Courtney is saying proposed visit instead of encounter a specific meeting in the VA. We can work through that together. That's important. Visit and encounter. And can you come off mic and just help us understand what that means? Just
Sure, sure. So encounter in VA world means a visit which is has workload credit attached to it,
Mhm.
whereas a visit can generate workload or not.
Oh, like
And
a community health worker versus a clinician.
right, or even just an educational visit versus, a clinical encounter that meets specific criteria for, you did a history, you made an assessment and a plan,
Yeah.
right?
Yeah.
So, visit, like I said, encounter has very specific meaning in the VA, and I don't know, maybe in Department of Defense too, I'm not entirely sure. But and the reason we use visit is because appointment implies that there is scheduling around
Yes.
it,
Yeah.
whereas visit, could be scheduled or unscheduled.
Okay, then everything you said just made a lot of sense. That's why we did not use appointment, right? And we expanded to encounter, hoping to be more inclusive, but it sounds like that's not even as inclusive as visit would be, which would encompass all of those touch points.
Hmm.
Okay. How are we feeling about that shift, friends? Easy to do. If it's something that requires more thought, again, yes, with comment means we bring it back if you're uncomfortable with anything that we're doing here. Because you can maybe I should just say that if it's like yeah, I'm just trying to figure out how to address this. We can't change what we're voting on, right? Actually, we can't do that. So maybe what we can do is agree to we either agree that we all agree that what we're voting on is visit, but then everybody's not on the call is not going to be part of that. So I'm sorry, I'm literally thinking this through in real time because this doesn't always happen. For the sake of process, to make sure that people who've already voted are voting on the same thing we're voting on, because there's absentee voting, we're going to bring that concept back in just 6 short weeks and rediscuss it because I don't want to have anybody voting on different things. Does that make sense?
Hmm.
Is everyone agreed that that's a good process? Just caring about, yeah, we're all good. Okay, so there's a few other things that I mentioned were late breaking things, so we'll just bring that bit back to make sure we're all on the same page. Sound good? Okay. Yay! No, welcome. Great. Welcome. We love new people. But I just want to make sure that everyone who's already voted is voting on the same things that we're voting on. Okay. Next slide. And next slide. You can see the rules thing is here too. Next slide. There were some definition changes. Again, really expert, thorough, careful review down to the definitions. People noted that names had changed of some of our includes but not limited to vendors, and so we replaced them. Thank you so much. Next slide. And again, this is the same thing. This also carries all the same conversations and caveats and considerations we just had. Next slide. Any other questions before we flip into digital literacy instruments? Oh, find help lowercase. Thank you. Next slide. This is again, no changes to instruments, so we can just go click, 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 and go through. Next slide. All we added here were definitions. These are all the definitions that we pulled from no changes in the terms themselves. These are all the definitions we pulled from our health literacy work. Again, thanks to Sarah Bahal and Hamali and the team for keeping track of all these things and making sure they're all tidy. The amount of change management in the background, it's extensive just to make sure that our processes are tidy and auditable and correct. Next slide, please. Any questions? So I'm just going to summarize a few things. We agree that we're working on, the name and definition of non-attorney legal advocate. If there's any concerns regarding that, a yes with common is fine. We also heard Courtney speak to a change in what we might be voting on by asking for an alteration of encounter to become visit. We're going to bring back that in 6 weeks because it's easy to reconsider together. I didn't hear any dissonance to that, but I don't want to have people voting on different things. And then what else? I think that was it for the comments. Am I missing anything in capturing comments from that time? I think we're good. Okay. All right. Next slide. Again, so someone was asking what happens after end-to-end review. This is it. So we're now going to go into things that carry forward from past domains that we just need to address because of implementation changes or because of the science evolving. This is an example of what will happen when we bring back those terms to those things we've talked about into September 28th. Next slide. Next slide. Voting again. We vote on these two. This is our update to the term coordination, the definition of the term coordination. This is our update to the definition of referral. Again, these types of definitions infuse the meaning of all the intervention terms that we use, like refer to has the meaning of referral underneath it. And then we've worked on these together again over the last 4 months. Next slide. And then there's the addition of the lovely adjustment term that came out of the NASEM report, integrating social care into the delivery of healthcare. There will be just one term across every domain, which is adjustment of clinical plan to accommodate social risk. In clinical practice, I think of this one every day, right? I'm still in family practice, rural family practice, and this is the truth of what I do every day with patients, sad but true. So I think about how this term will enable me to document how we're just adapting and trying to meet patients where they are as we work to address the structural forces that perpetuate the things we see. Any questions on these? Will this need to be adjusted to include commercial determinants of risk? Rachel, I don't know if I understand. I would love to understand.
Thanks. I have just been reading about commercial determinants of health and anticipating the opportunities in terms of integration and bringing this forward. And it just, I guess it's a general question or maybe a future definition adjustment, or maybe there is another area for this category, but it seems to me to have a lot of potential and seemed appropriate in this area to link the two and make the distinction and move it forward.
Thank you so much. So, I have to admit, with my head deep down in the many initiatives that I have, could you send me some of send us some of the literature that you're referencing for that? That'd be, and of course I can search for it too, but I want to make sure we're aligned. Our scope is social, right? So we work in the, with all the complexities and differences of what we mean when we say social determinants of health. If we think about the World Health, our framework model has always been the World Health Organization framework for conceptual framework for action on the social determinants of health. So it's in that bucket, it's in our domain. If it's outside of that bucket, it's outside of that domain. And if anybody ever needs to remember that framework, I think it's on a conference page now. But look forward to understanding what you mean, and then we'll go forward. Thank you. Our community is pretty amazing. I love this. Wonderful. All of this. Fantastic. Oh, yeah. So behavior. Yeah. So those, thank you to the amazing crowdsourcing of the team. And I mean, literally, I feel like I just say things and they enter the chat and we say things and we're all such a learning environment together. As written, those would be outside of our current scope. If we think about another of our foundational papers is the National Academy's Capturing Social and Behavioral Risk Factors in Electronic Health Records report. the phase 1 and phase 2 report. And those are not like, so we are solidly in the or even think about the Healthy People 2030, like social determinants of health wheels. We're solidly within the socioeconomic, environmental, and psychosocial realms right now. And that's been and there's a lot of real estate to do. When I say the operating committee has a lot to work through, there's still lots of domains in those that we haven't addressed yet. So if that is what commercial determinants of health means, and I have not read the Lancet paper yet, as currently scoped, that would be outside of scope for Gravity right now. Whew. Fantastic. Okay. I think we're good. Wow. Okay. Always a robust conversation. And here it is, 4:53. Every time I'm like, it's going to be a short call. It never is. I love this about us. Next slide. Okay. And now I believe it's time to turn the mic over to the amazing Sarah Bahal. You all get to see her amazing self. The critical blue. Hi.
Hi, everyone.
I know. We are so grateful for her. So Sarah Bahal, take it away.
All right, so I will be guiding us through consensus voting. Here, the slide just shows our consensus voting options, and Sarah reviewed this earlier in the meeting. So we have yes, yes with comment, formal objection, and abstain, noting that those choosing yes with comment and formal objection should send comments to the Gravity Project at hl7.org by August 24th, which is next week on Thursday. Next slide. Here we have information about the vote. So voting is done via Google Poll, and we have a link for that here, and I will send it in the chat. We ask that participants submit their vote by tomorrow, August 18th at 5 p.m. Eastern Time. Within the Google Poll link, there'll be links to our master list, so our digital literacy master file, our digital access master file, and then also the intervention framework addition and revision. And just noting, you have to press submit for the answers to be recorded. And please email comments to gravityproject@hl7.org, again by Thursday the 24th. And Asha, if I can, I'll share my screen and show them what the poll looks like.
Sarah, are you going to send that link to everybody, or do I have to copy this?
You should copy the link. Yeah, copy the link. It'll also be available in the slide deck, and we'll post the slide deck onto Confluence tomorrow.
It would be really helpful if you sent it out in an email instead of making work for us. Thank you.
We can send, so if there's any barriers to voting in this process, send an email saying, please send me the link. I'm going to say, if you have to vote by tomorrow afternoon, right? If you could do that by like tomorrow morning at 10 a.m. And you might have to click the link twice in order to get to it. Sometimes that happens. Like if I click it twice, it works for me. Oh, the link to
I can't do, I'm sorry, this is a total sidebar, but
okay.
links on the screen have to be cut and pasted and then dealt with when I remember. So
Okay. We can
if
make it work.
you could just send me the link in an email, that would be really nice if you haven't already, but I don't think you have. Thank you. Bye.
It looks like there's other barriers that we're seeing, Lucy, that we're happy. And again, we use current process until people tell us there's barriers to completing process, and then we adapt, and it's all good. We gotcha. Because it also looks like our friends at the VA are not able to access the link, so the email would be helpful because they're not able to capture it here. We are Operation Reducing Barriers, and so we can do that. So what Sarah Bahal is going to do is walk us through the poll, and then we can make sure we get the links to everybody in an email. Okay.
Mm-hmm. And if anybody is having difficulty in just accessing Google Polls, I know there's some issues sometimes with Google Links, you can email us your vote as well. As long as you email us saying you want to participate, I can respond and follow up and make sure your responses are recorded.
So does that make sense? Like if we just email gravityproject@hl7.org, we're going to, so Sarah, just to clarify, are we going to send a universal link to everybody? Or are we asking people to send you an email and then we'll reply with a link?
Please send it a universal email. You have everyone's information. That would be so convenient. Thank you.
Yeah, we'll send a universal email. And my second note is if you can't complete this Google form, even after getting the link via email because of some security issues, etc., then you can just email your vote to gravityproject@hl7.org and we'll record that.
And Sarah, would it be okay if I post the link here? So if somebody wants to vote, or should we wait to send it via email?
It is already in the chat.
Oh.
Yeah, and that's, but people are having a hard time accessing it. So we're talking about not just the chat. I just grabbed it from the chat and voted, but people are not able to do that. So we're going to do an email.
Got it.
Go team. Thank you, Sarah. Okay, now you can walk through the voting process. Everyone's going to get an email. You all can vote that way, and we're happy to address any barriers, whether they be institutional, state, or otherwise. And Sarah B, do you want to walk us through the actual poll?
Yeah, I can. So here's the poll. The information here is the same as in our slides, and there are links to the materials we're voting upon. So we have our digital access master file. If you click the link here, it'll redirect to our Confluence page, and you can download the master lists and see our definitions all up here. The same process for the digital literacy master file. For the interventions framework, we have the revisions listed here. And if you scroll down a little bit further, once you get to the interventions framework specific question, we have the framework here for reference as well, our current Gravity Project interventions framework. So what we ask participants to do is to go through, answer the questions. We'll ask you for an email, your first and last name, your Gravity Project community status. If you're not sure, you can check here. If you're not yet signed up for the Gravity Project, you can also sign up here as well. And then you select your consensus votes for the 2 domains and for our intervention framework revisions/addition. And also, if you're ever unsure that you submitted a vote, like you completed this form and you weren't sure if it was actually recorded, you can check this link here. It leads to a spreadsheet which lists those that's voted and the time that they voted.
Just now for me, you can see my name.
Mhm.
Sarah B, thank you for the beautiful poll. Sarah Bahal also is the person who puts together the really beautiful poll. And I just want to note the irony for a moment, and this has been present throughout, of us working on addressing digital barriers as we vote on our digital access and digital literacy domains. Because barriers are manifold. They're either complexity, or they're institutional, or they're state-wise, or they're like, so anyway, thank you. You get a sticker, Mike. You always get a sticker. Everyone gets a sticker. I want to note too, just from, again, I still see that Adrienne is here. Adrienne, thank you so much for your subject matter expertise. It was amazing. And then I think we can go back to the slides ever so quickly and close out. We have Ashley's going to go back. Thank you, Ashley. Thank you so much. All right. So email coming. And then next slide. I'm going to pause for 5 seconds and just say to all of you who have worked so hard and so with so much joy, I think. I mean, I find this work with you all very joyous and very important and very fun. Thank you so much. I always think of the stories I'm going to be able to tell, and it always gets me emotional. So I'm very looking forward to these terms being in the ecosystem so that we can document the stories of the people we see and care for every day. Next slide. And then if you ever need to highlight, so Sarah B updates this, all the consensus voting details are on the Confluence. You can submit those votes by tomorrow evening. Next slide. And friends, we will miss you. We will be working diligently. We are about to see some of you a whole lot more than we have. We had a summer off of our Snowhood friends. We'll see you soon. I've already written our IC10 CM experts and friends. We'll see them soon as well. But we'll see all of you again on the 28th as we restart our fall domains. always can join the technical workstream calls on Wednesday from 1 to 2. Join me and everyone else at the pilot workstream calls the last Thursday of each month from 2:30 to 4. Whoever's going to the Civitas conference, which is we're having a gravity pilot gathering there. I'll see you there. But mostly thank you, all of you, for your work. Incredibly exciting work that we've all done. Just grateful for all of your support and effort. And we will see you all soon. Any final thoughts before we go?
Sarah, this is Tom. Just real quickly, for folks who weren't aware, the CMS published its proposed changes to the reimbursement policies and are asking for comments by September 11. What's great is there's a huge section. So far, I've called over 40 pages related to social determinants, and it includes the work that we've done in that many of the codes will require including the Z codes as part of the reimbursement documentation. So what we're doing is being used.
It really is. It really is being used, and it's being used to support partners across the community, right? So part of what I love about those Z codes is they support not just clinical systems, but community-based organizations and the work they're doing too, because they can testify to it, right?
Yeah.
It's great. It's really quite powerful. The work we've done together and the work we continue to do. Thank you, Tom.
Thank you, Tom, you've reminded me, this is Lucy, that National Quality Forum and American Hospital Association are affiliating. I don't really know what that means legally, but maybe that's an opportunity. Maybe it's a new audience, hospitals. I don't know that we have had too many hospitals on our calls. If they've been attending, they haven't been talking that much. And of course, they do everything they do based on EHR design. And we haven't talked very much about EHR design either. So maybe that's something to start to pay attention to in the coming months.
Lucy, I'm not going to call them out, but AHA, American Hospital Association, has always been here. And they are here now.
Oh, hey.
Yeah, so I'm not.
Hey, would you please tell us?
I actually yeah, the American Hospital Association is always in the room, and they have been one of our most established partners in crafting those exact ICD-10 terms. They and our friends at AHIMA are the people we turn to make sure we get it right. And you saw a sweet little thumb up there, so you might. So I just want to note that AHA has been in the thick of this work with us from the get-go. So
if I hadn't said that, we wouldn't know that. So
I know, an
delighted to hear
opportunity
that.
for me to say thank you to our friends. Yeah, they're very critical in this work and have been for a very long time. And
Thank you, AHA. Does this open? So let me just ask you, does this open a new vista for Gravity, or this is everything we've done has already been absorbed?
I don't know if I want to put Tammy on the spot to answer that question.
Okay, sorry.
Yeah. I think I'm gonna, unless she volunteers to, but my guess is that would not be something she can answer. Does that make sense? Lucy, does that make sense? I'm sure it makes sense. Yeah. Okay. Any other questions?
I didn't mean to put anybody on the spot. I was just
it is a good time to
talking about general affairs, how the environment is changing. Thank you.
Yeah. Okay. Yeah. Any other comments before we go? They are always with us. Yes. All right. There is a lot of work. I just want to say for EHR connections and vendor connections and the kind of sea change that's happening over there, the pilot work stream is a pretty great place to go, because that is that's where there's a lot of collaborative pressure and momentum, pressure in the best sense, to all align with existing standards that we craft over here, right? So we're the makers over here, And then over in pilots, we're really trying to collectively advocate to create really intentional design, centralized intentional design with our vendor partners to get to aid in the mission. All right. See you all on September 28th. Thank you so much. We appreciate you. Okay, bye.